If you're planning to go to the US after your BDS in India and doing either the DDS or the master's program there, then one way to improve your resume is by giving the ADAT examination. And for that, we have with us Dr. Guru Prasad today, who's going to explain us all about ADAT. Dr. Guru Prasad, after completing his BDS from MCOD's Manipal, moved to the US. For his process, he also gave the ADAT examination in April 2022. Currently, he is a student at the Advanced Standing Program at the University of Pittsburgh School of Dental Medicine. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. Hi, Dr. Guru Prasad Ramani. Thank you for joining us today. My first question to you is, what is the ADAT exam?
Thank you so much for having me on this platform. So the ADAT, as an exam, it's called as Advanced Dental Admissions Test. It is one exam where most of the students take it to apply for residencies in the US, and some of the advanced standing programs in the US also consider ADAT as an additional exam. So you have like the national dental boards, the iNBDE, and then ADAT is one another exam apart from separate from iNBDE, where there is scores given for the exam, and then people choose to take it to boost their profile.
Understood. So, what is the duration of the examination? What is the format? How do they judge whether
So,
you're
uh,
pass or fail?
so there's no pass or fail. So the national boards is pass or fail. So they wanted to get this exam to view like a quantitative score, and it is scored from 200 to 800. And there will be 200 questions on the exam. So the first 80 questions is the biomedical sciences part, where anatomy will have like 20 questions, which has anatomy, gross anatomy, your head and neck, and then embryology and histology. Then we have the next 20 questions of physiology and biochemistry, another 20 questions of pathology and microbiology, and then the another 20 questions would be dental anatomy. So it's like coming from India, it will be like the first 2 years that we study in India, like BDS, it will be those subjects basically. The next 80 questions would be the clinical sciences, which is all the clinical dental subjects. Plus, we have pharmacology and pain control. So more into how to like when they say pain control, it will be like the ibuprofen and Tylenol and how things go around like in surgeries and stuff. And the last 40 questions would be biostatistics, where you have the different kinds of study design, the statistics, the odds ratio, and all those things for 40. So you have like 200 questions in total, and it's around 4.5 hours duration, the
Wow.
exam. Uh, 90, the first 80 questions, you will have like 90 minutes to finish. Then you have like a 10-minute optional break. And then for the clinical sciences, again, another 90 minutes, and again, a 10-minute optional break. And then the last biostats section will get like 45 minutes.
Oh, so it's a long, long exam.
Yeah, I mean, it is shorter than the iNBD in the sense that you're done in one day, because the iNBD, you have to take it in two parts. Like the first day will be 360 questions, and the next day is 150 questions. This is like, yeah, I mean, compared to iNBD, this has like biomedical. It's like the NBD part one, part two equivalent, if you have to
Understood.
say.
Got it. Now, what is the cost of giving this exam?
The cost right now is around 430 US dollars. And then if you're a graduate from a non-CODA accredited school, which is basically schools outside Canada and US, you'll have to pay an extra $250 for a processing fee. And then depending on how many reports or score reports that you want to give it out to schools, it is 50 per report. Like, let's say you want to give it to one school, it's going to be $50, and then so on. So if you're sending it to 7 schools, it will be 7 into 50.
Understood. Now, this is quite a huge sum, okay? And all universities
Mhm.
do not have ADAT compulsory. Would you still
Yeah.
advise people to take the ADAT exam, and why?
So um ADAT exam, especially for me, when I was in the applicant pool. Like I was pretty fresh as a graduate, and in a capid process like in the international dental applications, you are put in a pool where you come across people from different backgrounds, experiences, and varied this thing. So for me personally, I wasn't big on research experience as well. So it was mostly clinical for me. uh, I happened to be the US, like I gave my iNBDE, I was doing some shadowing, and then I happened to be in the US in March or April. So I thought like I would take this just in case, and if something clicks, then I would go ahead and like use this to boost my profile. The only thing to keep in mind is ADAT exam, unlike the national boards, it can be only taken from March 1st to August 31st every year. So for someone who's looking at this video, I would say that plan accordingly because there's only like a specific time frame that you could give this exam.
So you told me the exam pattern is different. The number of questions
Yeah.
and biostats and everything is asked. So is your preparation method for the ADAT exam different from the iNBD exam?
So since I was like the first batch, like the newest batch to give like iNBDE, uh, um, for me it was more preparation was more towards the clinical sciences. So for me, when I took started taking the ADAT, I had to focus a little more on the biomedical sciences part, because that has like a more of factual information and things that you need to remember, like biochemistry and all that stuff. Apart from that, biostats was something new for me, especially learning all those concepts. It is fine, but then it requires like you to understand the concepts. Then it will become easier. So I took like probably my most of the time. It was biostats which was taking my preparation time.
Understood. So now for iNBD, what were the resources you used, and what were the different resources you would ask people to study from or use to for the ADAT exam? Before you listen to the answer to that question, if you want YouTube to show you more such videos where you can grow your career after BDS, then do not forget to hit the like button because it would show the algorithm what other videos you would like to watch. And second thing, if you want to take your career to the next level after BDS, do not forget to subscribe to our channel because we keep on coming up with amazing content out here.
For the iNBD, I had studied Dental Decks Part 2. Right now, I think the Dental Decks have come up with an iNBD version, but I got hold of a Dental Decks Part 2, which covered like most of the dental subjects. And I went to Part 1 just for anatomy. Apart from that, I went through YouTube mental dental videos. And then there's this Facebook group called iNBD where different people who post like messages of them taking the exam clear recently and how their experience was. They will give like certain feedback, or they will even put out some questions as to what was the recent questions. It'll be in the file section called RQ. So some of the RQs I went through. So this was mainly it. Um, Now, how it was different for ADAT was biostats. Um, I didn't use like any subscription based, to study. But then what I did was I did some research. I went through, and for biostats, I saw like USMLE Part 1 had like a biostat section. So since I wanted to build on my concept, so it's something like I wanted to understand and not just simply blindly go to the exam. So that was like the biostats portion. And for the biomedical sciences, since I was fresh, I kind of remembered a little bit. At the same time, I had to supplement my memory by going to first aid part 1. So that was the kind of different preparation that I had to stick to.
Understood. So you told me biostats was a tough point. Any other subjects which you found which were tough, and how did you manage those?
Um, for me, biostats was something very new, but then the others were especially like I think probably biochemistry, microbiology, pathology. I can't say it was hard, but then from like medicine standpoint of view, those were the subjects which were like I had to brush up really well to make sure that I have to give the best in the exam.
So did you use any websites or any practice or mock test papers or something of that sorts?
Uh, I didn't use personally, but then when I interacted with people who had given ADAT, there were just like few people. Right now, there are more people taking ADAT. So they had told ADAT Knockout is a good source to for all these ADAT Knockout. Then you have Crack ADAT. All these go have like certain questions in their subscription, which is like a good experience. You know, you be prepared or you can gauge as to where your level of preparation is.
Understood. So now imagine someone is seeing this video and they want to ask you what is the thing they have to do different, or how do they get a mindset into starting preparing for the ADAT exam?
Um, I would say give like a good 2 to 3 months. Like makes basically plan your schedule because again the time frame comes into point. A good 2 to 3 months of focused studying should help you to get a decent score. And when I talk about like a decent score, anything above 500 should be fair game. Anything below 500, then probably you might want to retake it. Like this, I think, and with every year, since competition is increasing, the more you could score like above 500, the better chance you get at getting interviews. But that's the only thing I would say. And biostats, if someone's not familiar, then I would say like brush up through that. So that's important as well.
Understood. Any common mistakes you have seen your friends who gave ADAT exams they made?
So what happened was like like it's not a mistake, but something that to keep in mind. So when you're going through the dent pin your profile and you are trying to book a slot for the exam, what happens is there is no report to ADIA Capit, which is the common application portal for the international dental programs. So for me, since I was trying all in my effort to save as much money, basically, so if you had to report either the scores to at least one school in the US, it gets automatically added to Capit. So it said that you can place unlimited copies of your scores to, you can send unlimited copies of your scores to schools even before I paid for the exam. So it'll be like $0 I spend for sending out all the scores to all the schools. And automatically Capit comes in. The only thing that I failed to take into consideration is no, if I, it was like how do I put it? Like the score is going to get reported for sure. So if I got a low score, then it would have gotten reported and it wouldn't be nice on the profile. So if you are not sure about that, then don't report it, and then you can report as you want, like additional copies, 50 per this thing, if you're not sure about it. And the other thing is you don't need to report your ADAT scores to schools which say that we don't consider ADAT. Only use send it to those schools who say that they do look at ADAT scores. And again, ADAT is not a complete necessity, but it's a useful thing to boost your profile with.
That's a very good mistake you pointed out, because a lot of people think it's better to save cost and they would have just directly put it in the cap at this. But if you score like
Yeah,
something 300, 350, and it goes out to all the schools who even consider ADAT, if you are
yeah,
trying to boost your score with it, it would have the reverse effect. So that's
yeah,
absolute
exactly.
good advice out there.
Because
Uh,
you take iNBDE, which is pass or fail, and then the ADAT score comes in, which will kind of have a negative impact on your IIBD. Like it would be looking like as though you cleared it out of chance, which I mean, there's so much happening, you don't want to give that a chance. That's the only thing I would say.
yes, perfect. Any other take home advice to someone who's watching this and in the position where you were, like, say, 1.5 year ago?
Uh, be confident, believe in yourself, and just be plan ahead of time so that you are in the top of your game. That's all I'd say.
That's a lot of value you're given in this video. But now, if someone wants to contact you, how can they do that?
They can reach out to me on Instagram. I'm pretty active on Instagram. They can send in a request, and then I'm happy to help them whatever way I can do.
Great. So what we'll do is we will add his Instagram profile as a collaboration post on our Instagram page. So you can go there, check it out, send him a request. Remember one thing, all the people who come on these podcasts are extremely busy. They try answering as much as questions and as much as queries as possible. So I'm sure he will also try his best.
Yeah.
Thank you, Dr. Guru Prasad, for taking time and joining us today.
Thank you so much for having me on this platform.
If you like this video and want to go to the USA after BDS, do not forget to go and check out our USA after BDS playlist, where we have explained various options of going to the USA and have interviews with a lot of people who have successfully done it.